Hey, it's Dr. Schmidt. So I have a lot of information to go over with this video. I'm kind of treating it like a mini seminar. And to the very bottom of this video box, you can see that red line, the playhead or the timeline, if you will. And it's divided into chapters. So this is a new feature that YouTube has, and it makes it really nice. You can like hover your cursor over that segment of the timeline and see if you're interested in that chapter. So I'll label it, and let's get started. So the first thing I want to go over is this ridiculous Tuno. This is a can of soy, and it's made to be like fake tuna. And I bought it accidentally. And so I'm at the grocery store. This is before the lockdown, so I've been holding on to this for like 5 months or something. Because I'm not going back into the store with a mask on. I'm not going to wear a mask. And so therefore I haven't returned it. But in the tuna section, they had small cans that were 99 cents, small cans of tuna, and then larger cans. These larger cans were like safe catch tuna, or they were flavored with some mustard or various other seasonings. And that sort of tuna actually was in this size of can with this shape and this color. So when I saw this, it was priced about 20 or 30 cents less than the other tunas. So I just grabbed it without knowing that it's not tuna at all. It's soy. And I don't even want to use the term fake tuna because it's not tuna. It's soy. And the value of the ingredients in here is probably 3 cents. So when I opened it up and it smelled like cat food, it looked like cat food. It was in this gelatin, and I have four. So do you want them? Like, I don't know what to do with them. I don't want to give them to a human being, and I'm sure a cat wouldn't want to eat it. So grocery stores should have their fake food in a corner, not like dispersed throughout the store. So the fake tuna should be with the fake bacon and the fake meat, and now they're talking about 3D printed meat. So all that fake food should be in one section of the grocery store. Therefore, nobody else would be confused like I was, and therefore all the vegans can just go to one convenient location in the store. They don't have to go shopping all around and looking for things. They just go to that location and there's their food. It's easier for them. It's easier for non-vegans. And therefore, I don't, people like me don't have to go back and try to return this. So there's Tuno. Don't buy Tuno. It's horrible. All right, next section. I want to talk about cataracts. And there's surgery for cataracts, and it's like basically very successful. And I've always struggled with it, like as a nutritional based doctor, chiropractor. And I've been in practice since '97, and I finally have a solution that one patient had success with, and it's N-acetylcysteine, otherwise known as NAC, N-acetylcysteine and vitamin A, and she had been on this for over a year, and then when she went back to the ophthalmologist, her cataract was completely gone. So N-acetylcysteine and vitamin A. All right, the next subject. These are all different subjects. I'm gonna jump around, and these are ideas that I gather up throughout the week as I'm discovering new things and lessons are being learned, and I want to share them with you. Okay, the next thing is about pop drinkers, or also known as soda drinkers or soda pop, whatever you want to call it, Pepsi, Coke. I have seen in my career a number of people who are hardcore pop drinkers, 3 or 6 a day for a decade or 2 decades. And I'd have to say that they are by far the sickest people, chronically ill people that I've seen because, and here's why. So food has to do three things. Number one, provide energy. Number two, support life. And number three, repair tissue. So pop does number one, it provides energy. It doesn't support life and it doesn't repair tissue. It is not food. Junk food is not food. Like this. This is not food. Um, it's so the point here is like pop is destructive to tissue. What tissue? Well, all of it. It destroys all tissue. So yeah, there's 35-year-old men that have osteoporosis because they drink pop in large quantities. And so like that's a certain situation. So chronic fatigue and fibromyalgia and chronic aches and pains and the destruction of all the tissues. And so pop can be very addictive, whether it's regular sugar pop or if it's artificial sweetened pop. It's part of that junk food category. It just needs to be not consumed. And I know the welfare programs like WIC whatever you want to call it, they pay for pop. And it should not be on that list. It should not be something that taxpayers pay for other people to consume. So there's my thoughts on that. Next thing I want to talk about is I had a patient who has acid reflux and bad burping. And the bottom line is her MD said the problem is that she's swallowing air. That was his diagnosis. So I'm just throwing this out there. I have heard some of the most ridiculous things in my career, and I'm sure that MDs are told by their patients what I say. And the MDs thinking that what I say is ridiculous too. And later on in this video, I'm going to go over some examples of weird things, funny things, ridiculous things that I say, and they say them all the time. Okay, but yeah, this woman is not having acid reflux because she's swallowing air. Next subject, true food allergies are actually rare. So in my career, I know that I've seen one person had a true food allergy to beef, and she got deathly ill from it. I have a relative, he is very, very allergic to cherries. And I had a patient long ago, for her it was mushrooms. And these are things that people are born with. Now, if you acquire a food allergy later in life that you didn't have younger, then that's not really a true food allergy. That can be reversed. And it comes down to organ function, like is your stomach, pancreas, liver working, gallbladder, small intestine, all that stuff has to be working. And then any dysbiosis of the microbiome, meaning any unfriendly bacteria or fungus in the gut, all that stuff, once that's corrected, or parasites especially, when you get that stuff cleaned out, then these food allergies go away. So just had to put that out there. Now, when patients tell me I'm allergic to dairy, I really don't necessarily see that as a genetic thing until it's proven otherwise. So people go through my programs, their health improves, then the allergy gets better. But I appreciate it when people tell me, hey, I'm allergic to dairy, or I'm allergic to bread, I'm allergic to alcohol. Then I know what they're eating. So then I tell them, stop eating it, let's work on your health. You can experiment later, but just know that those foods are just bad. They're just in our food supply. They're chemicalized and they're high carb or whatever, or vegetable oils. They're just bad for everybody. All right, the next thing I want to talk about is sometimes I have a patient whose spouse disagrees with what I say, or with holistic healthcare, or with supplements, and they're more like allopathic. And I've seen this happen a few times, and it can be very detrimental to the patient that I'm talking to, because the spouse overrules, and then the person I'm trying to take care of doesn't get better. There's that dynamic that sometimes I deal with, and I'm just sharing this with you because when I'm talking with a patient, I do want to know that your spouse is on board, and you're like, maybe if your kids are adults, they need to be on board. If there's one person in your family that's trying to chop that, stop it, then they sort of usually are successful. One person in the family can stop all of this, all the good progress. Okay, I got a million stories to back that up, but I'm gonna stop right there. All right, the next thing I want to go over is what food makes you feel amazing. So I had a patient recently, she's saying that beets make her feel amazing. And personally, steak makes me feel amazing. Not necessarily pork steak or not even burger meat, but definitely like a steak cut. It makes a big difference that it's actually just fresh cut beef steak. Could be lamb, um, but usually it's beef. So, what foods make you feel amazing? Please type it below and read what other people type in. And I just want to see what people say and just share with what foods make you feel amazing. So I know there's a lot of people, they need their protein, they need their meat, let's say chicken or whatever, but vegetables make them feel amazing. So what vegetables make you feel amazing? What food is it? So just share with everybody else. Type that in below. Thank you. I appreciate it. Okay, I'm going to share with you some words that patients say that I don't understand and I need to clarify. And I ask questions about it. Then I'm going to go over words that I say or questions that I ask that are weird. So when a patient says to me that there was a shift, I have no idea what that means. That word shift means nothing. I'm looking for better, worse, or the same. So that's a question I ask all the time. Are you better, worse, or the same? And so let's say I don't talk to somebody for 2 months. Now I'm on the phone with them and I say, how's your health? And they say, well, I still have pain. I still have, my jaw's still sore. I still have headaches. Okay, 2 months of doing my program, you should be better. Now I go through all the particular symptoms. Okay, so how's your headaches now compared to 2 months ago? Is it better, worse, or the same? And typically the answer is, oh, better. It's better. So here's my next weird question I ask all the time. How much better is it on a scale of 0 to 100%? Give me a number. And the answer might be 5%, it might be 90%. Okay, even though they still have that pain or the headache, at least we know that it's better. Now, if it's worse or the same, I need to make some changes. If it's doing better, we keep going. Another statement that people say to me sometimes is something like rebalance. I don't know what that means. Nobody knows what that means. It's either make an improvement or stop something that's causing harm. And then some people ask me about, I need to balance my hormones. I have no idea what that means. You got to talk in terms of symptoms. What symptoms do you have that make you think you need to balance your hormone? So I'm looking for, what's your body saying? So your body's giving us a language. The language is symptoms. It's telling us something by how it's feeling or how it's performing, how it's functioning, digestion, pain, joints, stiffness, brain function, eyes, all that stuff. That's the language that your body is talking in. So you tell me what your body is saying, and then together we try to figure it out. Sort of a weird question I ask all the time is, what made you get better? If there was a symptom that got better or overall you're doing better, my next question is, what is the most important thing that helped you feel better? And it's a very difficult question. And I usually say that. I'll ask a question, then I'll say, this is a hard question. So then people they start thinking, well, I don't know. It could be that one supplement, or maybe I'm going to bed earlier, or because I got new inserts in my shoes. So there's this term called date coincident. So something happened in the past, and now a change occurred after that. So it's like A causes B, and we try to figure that out. That's part of the puzzle. Another weird question that I ask is, what happened just before your problem started? So if somebody says, let me give you an example. So I have a woman, she's college aged, and she was gaining weight. She was up 15 or 20 pounds, and she had some other symptoms. And I just simply drew a line, and it was past and then present. And I said, okay, so here's the dates, here's the years, here's the months. So mark where you started to feel bad and where you started to gain weight. And so she marked it on the timeline. And then I said, and I just pointed, what happened just before then? And she goes, oh, that's when I moved to college. Okay, great. So what's the difference between you in college versus you at home? And she goes, oh, it's my diet. So that was the aha moment for her. Now I knew it was coming. That's my job. She needed to find that out on her own. So I was guiding her to figure that out using that timeline history that I'm talking about. Finding out A causing B somewhere along the timeline, and finding out the areas that are date coincident. All right, here's some more things that I say that might be weird when you look at it from the viewpoint of a conventional medical doctor. So if a patient says to me, I have anxiety, my next question is, where is it? So oftentimes it's right here in the chest. It could be in the stomach. It could be in the back of the head or below the neck on the back here. Or it could be, I have one patient, it's in her wrists. So the location of anxiety is important. And I ask that question. In the viewpoint of conventional medicine, it's not a thing. It's not like an organ. It's not physiology. I'm looking for physiology, right? But in conventional medicine, anxiety is you. It's your personality. It's the way you're born. It's the way you are. It's your character. And therefore, you need psychiatric chemical handcuffs. But that's not how to go about it. That's just, it's okay temporarily if you need it. But if, a real doctor would try to find the cause and try to fix that. Okay, another statement that I say that might be weird in the eyes of conventional medicine is, enjoy your new supplements. So with all my experience with diet and supplements, and when I do the biofeedback testing procedure, I got somebody in the room, and I find something that makes sense. I know it'll help them. Sometimes as I walk out the room, I'll say, enjoy your new supplements. Imagine a conventional medical doctor is saying to a patient, enjoy your new statin drug. Enjoy your new blood pressure drug. Enjoy your chemotherapy. Like, that doesn't happen because these are poisons. They all have negative side effects. It's my belief they are designed to have negative side effects. And so when I say to a patient, enjoy your new supplements, and I truly mean it, and I know they're going to feel better with it, it's kind of a weird thing for somebody to hear about. Okay, another weird thing I say is, this supplement has adrenals in it, or this supplement has brain in it. And that's because they're glandulars. And this idea of eating glands has been taken out of our culture for many decades. I mean, you could buy pig brain or lamb brain or sheep brain at delis back in the 1960s at most grocery stores. And it's unfortunate that's been taken out of our culture. So another weird question I ask is, have you gotten any parasites out? And people say, well, what do you mean by that? And I say, into the toilet, or maybe into the Kleenex when you blow your nose. So I ask that quite often, especially when I give somebody some parasitic supplements. Another weird thing I say is brain fatigue, or your brain is fried. And I've done some marketing about that subject of, is your brain fried? And I've had some people email saying, what does that mean? That's not a medical diagnosis. And I say, yeah, that's exactly the point. So in medicine, they're not going to diagnose you with, oh, your brain is tired, or oh, you've been looking at the computer screen for too long, and therefore you need some brain food. So this whole language and this way of talking is weird, but it makes sense. It's the most um, applicable clinical thing that I can think of that helps been helping thousands of patients in my whole career, including myself. Back the first time I needed brain food was 1998. I studied muscle testing so hard in December of 98, I fried my brain. I could feel it, and I couldn't recover during the weekend, so I took a supplement called RNA. And after 1 month, I took 15 a day. After 1 month, I felt better. And I've taken RNA now 6 times since then. I'm currently on it now because of COVID, and the lockdown has been very stressful for the old noggin. Another weird question I ask is, are you eating more red meat? Because I'll tell people, eat more red meat. Or, are you eating more liver? So this is so far out of the medical realm because they want you eating stuff like soy tuna or more, greens, and avoid red meat, avoid fat because it's bad. All right, the last story I want to go over is this idea that not everything is a mineral deficiency. So I hear now more than ever before that somebody's telling me I have a mineral deficiency. And then they tell me, well, I've been taking lots of magnesium and I still feel bad. Or I've been taking a lot of potassium and I still feel bad. And it's kind of like that's the culture online right now, is that people are talking about deficiency of salt because of low carb keto. Or there's some really good marketing for electrolyte powders, which is fine. And so a lot of people are thinking I have a mineral deficiency or electrolyte imbalance or something like that. And so I'm just saying, like, not everything is that. And if everything was a mineral deficiency or electrolyte imbalance or something, then it would be such an easy fix. Because you could just take a ton of different electrolytes and drink San Pellegrino water and use more salt, and everything would get better, better, better. But it's just not that easy. Now, I know earlier in my career, it was other products that were the fix for everything. Sort of like phytochemicals or enzymes. CoQ10 had a big marketing push. Resveratrol had a big marketing push. Some of those tropical fruit juices, they had some big marketing back 15 years ago, like meringue or whatever, moringa. And so there's phases of marketing. There's phases of products. So right now it seems like what I'm hearing is minerals, and go ahead and take minerals, but just know that you should be feeling better. And I do provide a lot of minerals, and I give a variety of minerals depending on symptoms and how your body's performing. So I have some minerals that have just a little bit of extra iodine. I have some minerals that are liquid, and some that are more tablets. I have higher dose minerals. I have nano minerals, and they all perform differently. So I'm not discounting minerals at all. But when you take minerals, if you think your problem is mineral deficiency, you should start to feel better once you start taking them. And if you don't feel better, then it's just not that. So I'm going to share with you one story of a guy that he's been with me for a few years, and probably one of the most difficult cases that I have. And he went through the 5 phases of healing. These are the 5 phases of healing right here. And this could take up to a year to get through, or maybe even longer. For some people, it's shorter. But you can take a screenshot of this and you can learn from it. So as he went through all of it, he had success at phase 4. For the first time in many years, he felt normal. And that is absolutely fantastic. So on the phone, I said, what were you taking in phase 4? Let's be specific. And he said that he thought the one product that felt the best for him was the iodine product, which is a mineral. Now he had been in my office, a year and a half, 2 years ago, about a year and a half ago. And when I did the muscle testing, I said, I think you have a mineral deficiency. I hope it's just that simple. Okay, but really took him many months because he lives out of state, and with some of my guidance. But it is a mineral deficiency. It's iodine. So now he's doing iodine and a couple and two other products, and that's it. And if we can recreate how he felt in phase four of these 5 phases, then be back to normal. And so iodine is heavily needed by the thyroid, and all the cells in the body love iodine. So hopefully this is it, and chances are very high that this is the solution. And so in this case, it just took a while, and he's been very perseverant, which is fantastic, and he's getting the results that he's been looking for. And I commend him for charging forward and not giving up, and I really appreciate that. All right, so there's a wide variety of topics that I went through. If you need some help, you can contact the office. You can become a patient. And don't forget, I have the free ebook. Go below in the video description box. And this ebook, you don't have to give your email to us. You just download it. And along with it comes a free video course. And for that one, you got to give us your email. And I have now multiple other video courses, and I'm working on another ebook that'll be free. So the video courses you have to pay for them. So they're all on my front page of my website. So check it out. That way you can get all the data. So with over 400 videos on YouTube, you get a little bit of data over the course of many years, interspersed throughout the internet. And there's no order, and there's no like spoon feeding the information to you. But I have it in the courses and in the ebooks. I'm spoon feeding it to you. I've been creating these courses and ebooks now for a year. Hardcore, like it's another job. And that's why my attention on YouTube has been a little bit more diminished compared to the previous 3 years, because I'm trying to compile all this information so that you can just have it. And once you have it, now you have it for the rest of your life. You own that material, and you can share it with your family members and help other people too, and especially help yourself. All right, so see you at the next video.